Hello everyone, welcome back sa ating channel, and for today's video, we are going to discuss another nursing concept po. It's been a while since our nursing concept video, and for today, we are going to discuss a very requested topic po sa ating comment section by these following students. Okay, we are going to discuss your nursing care plan, and thank you for watching my videos guys. Shout out sa inyo. I will not read the names na kasing hindi ko alam basahin, especially the first one. But thank you very much for subscribing to our channel and watching our videos. For today's video, we are going to discuss the most requested topic, as you can see in our chat comment section, which is your nursing care plan. So how are we going to create a proper nursing care plan? Before we proceed to the actual discussion, guys, don't forget to subscribe to our channel, and of course comment naman po kayo sa ating comment section anything that you want to say and you want to request as a topic na gusto nyo i-discuss natin, and of course share this video to your nursing friends as well. In creating your NCP, it is very important that you need to know how to follow the nursing process, which is your ADPI. So your assessment, followed by your nursing diagnosis, your planning, your implementation, and your evaluation. If you want to know more about this concept, the nursing process, I am going to attach the link po sa ating description box. Makikita nyo po doon yung mga videos natin about nursing process. Individual videos po yun about assessment, nursing diagnosis, planning, implementation, and evaluation. That will really help you to come up with a proper nursing care plan. Now, nursing care plan is a common topic that is being requested by nursing students, especially because this is actually one of their major requirements, especially when they go for a duty. By the way, heads up lang po that the discussion about NCP that I'll be doing today is based on a discussion by the Fundamentals of Nursing book by Kuzir. And I'll be giving examples later on, which is also crafted and extracted from the discussions po sa book ni Kuzir. My discussion about NCP is not that perfect, but I believe it is near, or at least pinakamalapit siya sa ideal NCP that you can actually create. And take note, each institutions, especially schools, have their different formats po in terms of your NCP, especially for nursing school, wherein nakadagdag sa column po yung tinatawag na rationale of each interventions that they are actually performing. Now, for today's video, we will be doing, or we will be using the general example, or the general format for the NCP, which is this one. It has the assessment, it has the nursing diagnosis, the planning, the intervention or the implementation, and the last column is gonna be the evaluation. So depende na lang po sa inyo, or it depends on you guys on what is the format that you are using. You can just actually insert this, but these are the 5 major columns that should be always present whenever you're going to create your NCP. Now, for this one, of course, we will be needing a problem. So before we can come up with the example of your nursing care plan. So let's start with this example. So a patient with pneumonia has the following assessment data. So the patient states, I feel like catching my breath, and you observe that she has colds for 2 weeks with complaints of dyspnea on exertion. She was observed to have occasional chills and with decreased oral intake for 2 days or two days. Yeah, for example, the decreased oral intake of water. Okay, she has dry mucous membranes, flushed cheeks, and skin is warm to touch. She looks pale in appearance and with inspiratory crackle sounds in both lungs upon auscultation. The patient appears to be lethargic with the following vital signs of the temperature, which is 37.9, okay, pulse rate of 92, shallow, and it's shallow with 22 breaths per minute respiration, and oxygen saturation of 89% with the blood pressure reads at 122 over 80 millimeter mercury. So these are the data, for examples that I have assessed from our patient. But of course, though the medical diagnosis, which is pneumonia, one of the common mistakes that students do whenever they create their NCP is that they always base it on the medical diagnosis that the doctor has made. That is not entirely correct, guys. Though it works sometime, however, nursing diagnosis should be based on the proper assessment that you have gathered during your patient interaction. Okay, siguro if there is one thing that I can advise you guys is that you really have to use your therapeutic communications, your communication skills in gathering data, because if you have lack data, if you have a lack of assessment data, you'll not be able to create a proper NCP. Okay, I always tell this to my students. Okay, interview your patient, observe for anything that you consider is abnormal, and always ask for the correct questions. Always ask or always communicate properly, and hindi yung whenever you contact your patient, the only thing that you can ask is that may masakit po ba, and when the patient reply that there's nothing wrong with them, wala naman po masakit, nagkakaroon tayo ng problema. Okay, so that's one thing that I advise that you need to improve your communication skills. So let's go back to this example, guys. So the patient has the following signs and symptoms, and by just looking at these signs and symptoms, guys, you'll be able to come up already with several nursing diagnoses that would lead you to create several NCP. However, if we are going to follow, okay, if we are going to follow the principle of prioritization, we will be able to prioritize what could be the possible nursing diagnosis that is proper and should be prioritized for this patient. So the first thing that we need to do is that we need to categorize or collate the information that we have gathered. And speaking of categorization or collation, the common thing that we do is to separate the data from your subjective and objective data. Okay, to separate your data from the subjective and objective data. So let's collate the information now. So this is an example of a collated information based from the example that I have shown you guys. So the subjective data is I feel like catching my breath. As you observe here, wala na po nakalagay, or there is not such thing as verbalized by the patient. Okay? Okay, kasi when talk about subjective data, it's automatic that the subjective data is provided by the client alone. Okay, provided or there are instances that students are actually putting as verbalized by the watcher, as verbalized by the mother. That is not correct. Okay, kasi from the definition of subjective data itself, these are information that can only be perceived by the client or the patient. Therefore, whenever we put data which is considered subjective in our assessment data, automatic, it is provided or it is perceived by the patient. So it's no longer need to put verbalized by the patient or verbalized by the patient. But if you want to, you can just simply put as verbalized. Okay, as verbalized. That suffice that it means to say that the information is actually provided by the patient and no other person can actually provide that. Okay, and the objective data are the following. So colds for more than 2 weeks noted, dyspnea on exertion, occasional chills noted, decreased oral intake times 2 days noted. Okay, dry mucous membranes, cheeks, flushed skin, warm to touch, pale in appearance, and inspiratory crackle sounds in both lungs upon auscultation, and lethargic. Okay? So, baka magtaka po yung iba. Some of the information here can actually be placed under your subjective data. Like, for example, colds for more than 2 weeks. Okay, for colds for more than 2 weeks, sometimes are verbalized by the patient. Kasi tinatanong mo kung ilang araw na. But nilagay ko siya sa objective because it is already measurable. Okay, nasusukat na siya kasi 2 weeks na nga daw na walang or na siya sinisipon. And nakalagay din sa data natin, decreased oral intake, okay? Because that is something that we can also observe from the patient. Plus, it is already measurable. Kasi baka sabihin natin na binanggit naman ng pasyente yon. The patient actually verbalized that. Why not put that on the subjective data? Simply because it becomes now objective because it is measurable. So times 2 days. Okay, so that's the simple explanation for that. And if you try to think about it, if you try to look at here, okay, ang pasyente natin may decreased oral intake, dry mucous membranes, skin warm to touch, pain in appearance, respiratory crackle sounds in both lungs, auscultations, plus the patient has a vital signs of the following: 37.9, so you can see there, and auto saturation of 89%, and the blood pressure of 122 over 80 millimeter mercury. So if you're watching right now, okay, upon looking at this assessment, kindly please type in, okay, type in the possible nursing diagnosis that we can actually come up with based on this assessment findings that we have. Okay, so paki-comment lang po sa ating comment sections, and we'll try to look into that as well sa ating mga next videos. Okay, so if you're typing in right now, don't forget also to subscribe to our channel. Okay, and don't forget to hit like sa ating video kung nagugustuhan mo ang ating discussion as of the moment. Yun. So basically, siguro nakapag-isip ka ng mga possible nursing diagnosis dito, pagsama-samahin natin. Okay, basically, baka yung iba nakita na yung decreased oral intake, then dry mucous membranes, possibly, iniisip mo ang deficient fluid volume. That could actually possible as well. Nakalagay din dyan, 37.9, which is febrile by nature, so probably you are thinking about hyperthermia as one of your nursing diagnosis, okay? And yung iba sa inyo, baka na-observe na rin yung 89% plus yung 22 and shallow breathing, plus the patient is subjectively telling you that he feels like he is catching her breath. It's actually a dyspnea by nature. Okay, so that in that case, if we're trying to prioritize now the information, okay, ang ipa-prioritize natin is something that is actual problem that will follow the ABC approach, which is your airway, breathing, and circulation. In this case, since meron na tayong mababang auto saturation, and the auto saturation should be maintained at 95 to 100%, plus the patient is having dyspnea, most probably naisip mo that the priority nursing diagnosis should be related to the airway, okay, or to airway. Now, if you think of that, there are several nursing diagnoses na pwede nating gamitin, guys. Okay, if we try to relate it to airway. Okay, so what are those? We have the following. Okay, to check nyo si Nanda, we can make use of your ineffective airway clearance. Okay, and if you try to take a look at here, inability to clear secretions from the respiratory tract to maintain, that's actually the definition. And these are the defining characteristics, meaning if you have seen this defining characteristics of the patient, you may able to use ineffective airway clearance. And these are the possible nursing related factors or the problem related factors. So kung panonoorin niyo po yung videos natin about nursing diagnosis, dito nyo po i-apply si PES. What is PES? PES, the problem, etiology, and your signs and symptoms. Plus, these are the associated conditions. Okay? So, pwede rin naman natin gamitin si ineffective breathing pattern. Okay? So, si clearance po kasi is pag may nakabara sa daanan ng hangin. Ineffective breathing pattern naman, commonly nire-relate natin ito sa respiration ng pasyente. Kung normal ba or within range ng 12 to 20. Kapag not within the range, probably ang pasyente natin is may ineffective breathing pattern. Okay, another one that we can use is your impaired gas exchange, which is related naman sa ating auto saturation. Okay, so yung auto saturation natin is mababa, so possible din ito magamit natin. But for this case specifically, we will be using your ineffective airway clearance. Bakit ineffective airway clearance? I feel like catching my breath. So nahihirapan siyang huminga, decrease ang kanyang oral intake, and 2 weeks na siyang may sipon. Okay? At tapasin nyo, walang nakalagay dito na inuubo yung pasyente. Ibig sabihin, the patient is unable to what? Expectorate now your phlegm. Possibly, dry po yung oral niya, kaya malamang yung kanyang secretions is actually viscous. That is why upon auscultation, there is an inspiratory crackle sounds in both lungs. That's why we're able to come up with a nursing diagnosis of ineffective airway clearance related to viscous secretion and shallow chest expansion, secondary to deficient fluid volume and fatigue. Saan nanggaling si deficient fluid volume? Nanggaling siya sa decreased oral intake, and fatigue kay lethargic. Okay, guys, so you might be wondering why ineffective airway clearance instead of your ineffective gas exchange and your ineffective breathing pattern. Okay, bakit hindi po sila? Bakit mas prioritize ko si ineffective airway clearance? Take note, guys, that it's really about prioritization. Okay, if you try to look at the data that we have, okay, the patient is dyspneic. Okay, the patient has decreased oral intake and has an inspiratory crackle sound. So basically, this inspiratory crackle sound denotes that the mucus is actually viscous and it is in the windpipe. Okay, nandun siya sa ating bronchus mismo, causing na blockage sa ating airway passage. So that's why the clearance of airway to enter and inspire, and during inspiration and expiration is not that good. Okay, and your oxygen saturation plus ineffective airway, your ineffective breathing pattern was just a product of the ineffective airway clearance. Kasi kung maayos ang daanan ng hangin, yung gas exchange is maayos din. Same thing is true na kapag maayos ang daanan ng hangin, hindi magko-compensate ang lungs by doing more exertion on breathing. Okay? Kaya hindi siya breathing pattern. Mas applicable ang effective airway clearance. But to sum it up, okay, I mean, in general, you can actually make use of either of the three. But for this example, I have made use of ineffective airway clearance because that suits, that actually yung pinaka-suitable na nursing diagnosis for this example. And among the three, siya talaga yung priority based on this example. That is why I keep on telling that your NCP should be unique to each individual. Hindi yung kung ano yung ginamit ko ngayon, gagamitin ko na rin sa pasyenteng ito kasi parehas sila ng nursing diagnosis. That should not be the case. Why? Because maaring yung simptomas na meron ng pasyente kong ito ay wala sa simptomas ng pasyente ko na bago. Okay? That is why it is always based on the nursing assessment, on the assessment data that you have gathered if you're going to create now your NCP. Now, PES, when I tell PES, guys, problem, etiology, and signs and symptoms. That's very important when you create your nursing diagnosis. If you want to know more about that, I do have a video about nursing diagnosis sa ating comment section. So ineffective airway clearance, that is actually the problem. So what causes the problem? That's the etiology. The problem was actually caused by the viscous secretions and the shallow chest expansion that the patient has. And this viscous secretion, so yung viscous, sobrang lapot noong secretions. Why? Because the patient is dehydrated or there is a deficient fluid volume. Plus, the patient is not moving. Kasi nga, weak in appearance siya, lethargic, meron siyang fatigue. So, yung pasyente natin ay hindi maganda ang dahanan ng hangin kasi may viscous secretion at yung viscous secretion na yun ay dahil meron siyang kakulangan sa tubig plus hindi siya masyadong nagagalaw. That is why, hindi ba, post-operatively, we always ask the patient to move as much as possible. Dapat gumalaw na siya, matuto siyang mag-deep breathing exercise kasi nga prone sila na magkaroon ng pneumonia, especially if they're not moving. Okay, that's the reason why this is our actual nursing diagnosis. Now, okay, it's very important to complete the PES because according to the nursing process, yung interventions mo later on will be based, or your planning interventions will be based on the etiology or in the signs and symptoms that the patient has. Okay? Etiology or the signs and symptoms that the patient has. So, yun yung ating i-address ngayon. So, ano yung planning natin? So, let's go to your planning. For the planning, we have two types of planning, guys. We have your short-term goal and your long-term goal. So, depending now sa ating book na babasahin and depending sa setting kung saan ginagawa ang NCP, your short-term goal and long-term goal ay nakabase sa kung gaano katagal mo i-manage yung condition. For us in the academe, okay, we always follow that within the shift or within the 8 hours as a short-term goal. And beyond that, okay, long-term goal na siya. So if you want to know more about yung planning discussion, and if you want to know more about this knowledge, kindly please access the link about planning po sa ating description box. Okay, for this specific problem, I was able to come up with this planning. Okay, the short-term goal and the long-term goal. So after nursing intervention, the patient will be able to, take note ha, we are going to focus on the client's ability to perform, not on the nurse ability to perform. So yung ating goal should be linked on what the client or patient can do and not what on the nurse can do. Okay, so after the nursing intervention, the patient will be able to, short-term goal, within the shift, maintain a clear open airway as evidenced by, okay, normal depth and rate of respiration at 12 to 20 breaths per minute, use of correct breathing and coughing exercise, productive cough and O2 saturation of 95 to 100%. As you can see, I have multiple goals here. Why? Because later on, very important po siya to come up with the evaluation parameters. Because later on sa evaluation parameters, gagamitin din natin yung plan, okay, or the goals that we have set during the planning phase, okay? Namaya ipaparealize ko yan sa inyo during the evaluation phase. And I want you to be observant with the on how I actually created the planning. Okay? So meron tayong 12 to 20 breaths per minute. Meron tayong dapat kaya niya ng umubo. Tapos nakikita mo siya nagkakandak ng deep breathing exercise. Ang auto-saturation niya is 95 to 100%. All of these data are actually observable and measurable data, which is true. Okay? Na dapat pag nasiset tayo ng goal, it has to be smart. Okay? Smart, which is S, simple, M, measurable, A, attainable, R, realistic, and T, time-bound. Okay? And based on this, tignan natin pasyente natin, ang auto-saturation niya is not within the normal range, kaya ang gusto natin within the normal range na siya. Probably, ang pasyente natin hindi kapag excrete ng secretions, kaya gusto natin gumamit siya ng coughing exercise at magkaroon siya ng productive cough. A productive cough means the phlegm is no longer viscous. Ibig sabihin, kayang-kaya na siyang alisin ng ating katawan. And as we already know, coughing is actually one of the defense mechanism ng katawan natin to remove foreign objects. And secretions are considered to be foreign na, okay, that the body is trying to expel. Kaya nagkakaroon ng ubo. Okay, measurable data yan. And sa long-term goal po natin, maintain oral intake of 6 to 8 glasses per day and have a clear bilateral lung sound upon auscultation. Okay, kasi maintain, we have to observe. Okay, baka sabihin nyo kasi, nakikita naman yan, pag uminom siya ng 6 to 8 glasses within the shift, edi achieve na. Hindi eh. Kasi it has to be maintained. So, hindi lang kasya sa isang araw, dalawang araw. It has to be maintained. So, we have to observe that kung nagagawa niya consistently. Plus, the patient will have a clear bilateral lung sound. Take note, clear bilateral lung sound, hindi siya nakukuha overnight. Okay? So, those are the planning. Now, the interventions now, or the implementations, plus the implementation will be based on the planned activities or on the goals that we have set. So based on the goal, these are the plan or the interventions that we will be able to come up with. Okay, again, this is based on Nanda, so you can come up with your own interventions for as long as you are addressing the problems. Okay, yung problem na meron tayo. Kung gusto nating ma-achieve is ito, dapat ito yung meron. Okay, so in-arrange ko po yung ating interventions and implementations according to diagnostic interventions, which is the assessment, curative or the treatment interventions, and educative interventions. So, diagnostic test, meron tayong assess general status, force assessment muna tayo, monitor respiratory status, depth, rate, effort, skin color, complete dapat yan, auscultate for breath sounds, vital signs, monitor level of consciousness, and monitor the results of blood gases, x-rays, and incentive spirometry. All of those are actually assessment interventions, followed by curative interventions. These are the actual actions that we will be doing in order to address the condition of the patient. So curative siya, stay with the client because possible na baka magkaroon ng dyspneic episode and the signs of cyanosis. Maintain high backrest. Positioning the patient on high backrest promotes lung expansion. Then, of course, we cannot do this without the dependent nursing intervention, which is the doctor's order. So the doctor might order expectorant since the patient is unable to what? Expectorate the phlegm. Administer analgesics. Why? We have to address the fever as well. Administer O2 per nasal cannula. Why? 89% ng ating O2 saturation. Administer prescribed medication. Take note that these are crackle sounds. Probably there is already infection sa ating lungs. That's why antibiotic needs to be prescribed by the doctor and of course administered by the nurse. You also need to demonstrate to the patient, especially if it's the first time na may encounter nila, you have to demonstrate now your your deep breathing exercise, and you have to assist demonstrate on how to use incentive spirometry so that we can monitor the total of tidal volume that the lung can actually accommodate. Okay, and assist with postural drainage at 9 a.m. if it's ordered by the physician. Okay, then after that, you can also provide nursing education, such as you demonstrate and instruct to do deep breathing exercise, okay, and coughing techniques, plus remind and assist every 3 hours, and discuss the importance of increasing fluid intake, and discuss the importance of constant position change. All of these are actually meant to address yung ating problem, which is basic. Interventions, you have to address the etiology. Kapag hindi mo kayang i-address yung etiology or the cause, you address the signs and symptoms. In this case, we address both. We address the etiology, which is the viscous secretion, by doing these things: positioning, administering expected medications, okay, and providing educations. Plus, ang related niya kasi is deficient fluid volume, so we advise the patient also to increase fluid intake to liquefy the secretions. Okay, so that is the nursing interventions, and of course, we are going to implement this to address. Now, for the evaluation part, guys, okay, ito na yung sinasabi ko sa inyo kanina, we will be using now the set goals that we have done during the planning phase, okay? For the evaluation parameters, there are 3 things that you can actually evaluate, or no, maging interpretation ng evaluation mo. It can be not met, partially met, and met. For the evaluation parameter, okay, ito yung may evaluation parameter. This should be seen. Ito dapat yung nakikita sa ating evaluation. So, not met siya if no improvements in any of the given parameters. So, what are the parameters? Ito po yan. Okay? These are the parameters. No improvement. For example, the respiratory rate is still above or below the normal. The patient is still not able to do good coughing exercise, not coughing enough, and the patient is still, the autosat is still below 95%. It means to say that no parameters were met. That's why the interpretation is gonna be not met. It is partially met if some of the indicators were met. For example, 1 or 2 or 3 out of these 4 parameters for the short-term goals were met, but only 1 is not met. For example, yung kanyang auto saturation is still below 95% and still partially met pa rin siya. Fully met lang siya kapag lahat na ng ating parameters or the set goals were already met. Same thing is true sa ating long-term goals. Okay, dagdag ko lang dun sa long-term goals kasi nakalagay dyan, if both lung sound has crackles, okay, if both lung sound with crackles, yan. So, nag-focus lang ako sa lung sound. Pakidagdag na lang sa ating examples, the long-term goal, kailangan na-meet niya rin yung umiinom siya ng 68 glasses per day. Plus, clear lung sound to make it met yung kanyang evaluation. Okay, so again, this example of the nursing care plan is not as perfect. Okay, marami pa tayong pwedeng idagdag dito based on the findings dun sa actual patient nyo. I keep on reminding you guys that the NCP is unique for every patient. It's not necessarily mean that kung parehas sila ng diagnosis, ang magkaibang pasyente who has the same diagnosis will be having the same NCP. That's not the case because the NCP is based on the assessment findings that you found with the actual patient. Okay, there are some patients that are they feel that they can't breathe. However, if you try to look at their vital signs, normal naman. Okay, there are instances like that. So always base it on the assessment data that you actually found. And take note that NCP should be written in future tense. Kasi nga, it's a plan. It's a plan that you want to take. Okay, so that would end our video for today. Bye for now.